Cannabis is a hot topic in Israel. Everybody wants cannabis, everybody is using cannabis, and it's really an emerging pain treatment and also very problematic. We have a lot of experience in my clinic dealing with cannabis, and I will share it with you what's going on today now, especially in Israel. So the history of cannabis is long. Cannabis was used for thousands of years for the treatment of gout, muscle cramp, depression, pain, and other disorders. And as you see, in the more than 100 years ago, it was very common, very used, and actually official by the medical field to use cannabis. But during the 1937 Marijuana Act was introduced in the United States, and similarly in Europe, with punishment to anybody who will use cannabis. And since 1941, cannabis preparation was taken out of the US pharmacopoeia, and since then cannabis was not used and also hardly ever researched. So until the 1990s, when slowly cannabis came back to the medical field, treating various disorders and mainly pain. In Israel, we are able to provide cannabis since 2011, and since then it's slowly rising up as a new treatment, and actually many people almost daily come to our clinics asking for cannabis for various problems, and we have to deal with it. We don't have any good guidelines, but it's a changing, no doubt this is a changing field. So what is actually cannabis? We do have an endocannabinoid system in our body. We have currently known two endogenous cannabinoids. One is anandamide and 2-AG, and they are acting on two currently known cannabinoid receptors. There are probably more, but the most known one are CB1 and CB2. These are presynaptic receptors which modulate neurotransmitter release. CB1 is the most common one in the central nervous system. It is highly concentrated in the hippocampus, cortex, and basal ganglia, and therefore we have the psychoactive effect and motor phenomena with cannabis, and in low concentration in various other organs. CB2 is mainly in the immune system, spleen, leukocyte, and others, and it is more related to the anti-inflammatory effect of cannabis. Now, the plant itself is very heterogeneous. There are about more than 48 compounds in cannabis and 113 cannabinoids, i.e. substances that can act on the CB1 and CB2 receptors and activate them. So there are more than 113 cannabinoids, and the most known one are THC, tetrahydrocannabinoid, CBD, cannabidiol, and CBN, and these are the most known out of these 113 cannabinoids. The THC is the most loved one. This is the psychoactive part of cannabis. It is also acting as an anti-nausea, muscle relaxant, anti-nociceptive, and appetizer, and therefore it may be used for many people it was used for AIDS treatment as appetizer and sleep promoting, but the disadvantage is, of course, the psychoactive activity, which determines that you might not be able to use it during the day, unless you want to be high all day, but not everybody is possible. On the other hand, the CBD is an anti-inflammatory substance. It is immunomodulatory, anticonvulsive, probably, and antipsychotic. Actually, not antipsychotic, but working together with the THC. Now, these two are the most known one. All the other, included cannabidiol, is less known and less actually involved in the cannabis effect. And one of the problem is that actually the ratio of these two substances, these two cannabinoids in the plant, are dependent on few factors. One factor is the cannabis strain. There are few of them. And during the history, Others were developed more and more, in particular to contain more THC, to act more as a psychoactive effect. Second is the climate. Different climates, different temperature, different strains, and different compounds, THC and CBD. And the third is the technique of cultivation, the soil, the water, pesticides, and others. They determine the type of the plant you have and the compounds that it has. This is a main problem in Israel because we actually do not know what we give, what we provide to our patients. We don't, as physicians, know exactly what are the amount of CBD or THC. All we know is not for pharmaceutical companies, but rather from the agricultures who said, well, we have CBD this and this percent and THC this and this percent, and we depend on that. We don't know what is in the plant, and this is the problem, one of the problems that need to be solved in Israel and actually all over the world. Now, how is cannabis and headache disorders? The sad thing is that although during the history, cannabis is listed as one of the most known major migraine treatment effect, there are no controlled studies. There are not any good studies on migraine, cluster headache, or facial pain like trigeminal neuralgia and other pains in the literature. We don't actually know what is going on. There are a few case reports, and there are a lot of assessment of cannabis usage among headache, on the contrary, the headache among cannabis users, but we don't have good reports. We don't know actually how cannabis is working in headache. In Israel, we are able to provide cannabis to our patients. I mean, we don't provide, we provide the licensing issues, but we can provide licensing to using cannabis after treatment failure. And the definition of treatment failure depends on the headache expert on this country and pain specialist. If they decide treatment failure, we can provide cannabis. So it's merely on our personal experience. Nothing is by guidelines or whatever. Now, one of the main questions that we need to ask ourselves when we do it in Israel and actually in other countries, whether cannabis is good as an abortive medication or as preventive medication. And actually, the answer for that is relatively known. There are very few studies on cannabis on acute pain. They are listed here, and actually, it is more or less recognized that cannabis is not so effective for acute pain. So if you have a patient and he wants to use cannabis now, to smoke it or to inhale it or to swallow it, to relieve his own attack, it's not helpful. What about the cannabis for prevention of pain? So most of the data is not from headache disorders, but rather from malignant pain, fibromyalgia, and other types of pain. And also here, what you see is that cannabis is effective as preventive in malignant pain, some neuropathic pain, and also pain in Parkinson's disease. We don't have a good answer about CRPS, pain, PTSD, fibromyalgia, irritable bowel syndrome, etc. We don't have the information. We do have for malignant pain, and this actually opened the door for cannabis usage in Israel. What I wanted to share with you is my experience and our center experience with cannabis in Israel. Regarding migraine, we don't have good experience. Actually, we found it not as so effective, but these data are not yet elaborated. We do not have placebo for cannabis in Israel, so we can't compare directly, but we do have information about cluster headache, and this information is quite impressive. So what I'm presenting you now is a retrospective analysis of data from the last 3 years about cluster headache. We had about 120 cluster headache in our center, and of these, chronic cluster headache were about 26%, 31 patients. Of course, these numbers do not represent the true prevalence of cluster headache in the population, but rather its concentration in our clinic at a tertiary large headache clinic in Israel. And out of these, we treated with cannabis 18 subjects out of the 31 subjects who were considered treatment failure. Treatment failure with prednisone for long-term, calcium channel blockers, high dose, 480 milligrams and up, anticonvulsants, variety of them, lithium carbonate, opiates, also we used in stubborn cases. And those patients, those 18, were considered actually treatment failure to all these medications. So we provided cannabis with them. There were about 78% men, and the age was about almost 43 years average. The average duration of the pain prior to the treatment was about 9 years, and it meant a lot of suffering with this patient. And as you can see here, they had a lot of attacks. The 12 out of the 18 had 1 to 6 attacks every day. It's highly chronicity, with high chronicity. 6 of the 18 had 1 to 4 attacks in a week, and in 7 of the 18 patients had pain, continuous pain between the attack. Cannabis was used mainly as smoking. They could use it as an inhaler or as in oral, but mainly as smoking, and the average usage was 1 gram a day, which is more or less a cigarette, more or less smoking a day. We followed them up for up to 3 years. The averages was 1.8 years, so it's a consistent follow-up, and we do have knowledge of it for a long time. And these are the results, which you can see here on the left, decrease in pain frequency, the percentage. Then in the middle, the decrease in pain severity. And in the right, the satisfaction of the patient from the treatment itself. So the decrease of pain frequency was quite interesting. Half of the patient totally responded to cannabis, half did not at all to the pain frequency, like as if the response was all or none. Decrease in pain severity was more more spreaded, but also here you can see that the majority of them had quite good response, at least above 50% response to the pain. 3 patients did not respond at all to the pain, and basically more than 50% decrease in pain severity was observed in 83% of the subject, and more than 90% decrease in the pain severity in 61% of the subjects. And just to remind you, these subjects were all severe chronic cluster headache patients who did not respond to any known medications that we use, and the satisfaction was very high. As you see, out of 1 to 5, most of them, 67%, were highly satisfied from the treatment, and they still continue it. And today, actually, cannabis for chronic cluster headache is actually preferred by most of our patients, and I do think it is a good medication. So side effects were minor. We had few patients with dizziness. Some were unable to work or had difficulty to work because we do use it for all day long. Nausea in certain subjects, but altogether cannabis was well tolerated. Just to remind you, the cannabis treatment is not just an innocent issue. According to the known information, cannabis may cause dependency in 9% of the subject with heavy usage, and that is what we do with our patients. We do give them cannabis to be heavy users. So 1 of 10 may become dependent on cannabis, but at least it's 114 less lethal than alcohol, which is open to the public. Currently, we are involved in migraine treatment. We are using this device. This is an inhaler that is used to provide cannabis with inhalation with very known dosages, and we can use also a placebo with this. And we are doing a study with cannabis and chronic migraine. to see the efficiency of this plant in these chronic subjects. Thank you.